You know, I don't think when you go to school that you should have to take seminars like this. I don't think that you should pay all that money for school and then have to. You know, I think if they want you to learn what I have, then they should have me come on campus and teach it. I'd teach it for free. See? Because I like to help colleges, but more than that, I feel sorry for students. You know, my entire education cost me $1,535. That's what it cost me. Best bargain I ever made. Sometimes I make that back before 8 o'clock in the morning. See? Man, and then see, people say, why do I keep supporting colleges? Because why wouldn't you want to support something that gave you that ability? Now, you might hate somebody at the college, but that's immaterial. You must support your college. If you don't have a good college, then they could wipe guys like me out in a minute. See, people don't wipe out colleges. They wipe out individuals. So let's say all the colleges closed, and there was only people like me left to teach. They'd just come by one at a time and get the IRS on you and all this crap, and pretty soon there would be nothing left. This is why I support all the colleges that practices anything that looks like chiropractic. Now, you won't see me pushing someone like National College that has a president that stands there and tells that he's never seen any proof that chiropractic works. And that people should come to you and not ever get an adjustment. But they need physiotherapy. No, I won't support a man like that. I think he's nuts. See, but I'll support any college that's still teaching chiropractic. So, when you see something like this, there's different ways you can approach it. And one of the most conservative, least traumatic type adjusting that we have in chiropractic is Logan Basic. And it's a fantastic technique. I have done wonderful things with this Logan Basic. But I'll teach you a little bit. It doesn't take much to learn. It's just a lot of practice. What you would do on this patient is when you do, how many of you know Logan Basic? Well, who taught you? I did. Okay, well, I'll teach the rest of you. This is the part of your thumb you use, the outer part of your thumb. And the pressure you use is the pressure that you can stand on your eyeball. See? Now, when you do it, you put your hand like you're going to throw a baseball. See, these fingers should not be on buttocks, unless they're nice buttocks. But the thing is, your hand should be off the buttocks, and it's this thumb. And your contact point, the best way to describe it is about an inch over from the rectum and an inch up. Now, if you're going to do a right Logan Basic, you're going to use your right hand, and you're going to be on the right shape, but you're going to set on the left side. So if I was going to do this, and which side are we going to do it? We're going to do it on the side of sacrum base inferiority. And see, when the sacrum base does that, it goes anterior. Now, when Logan talks about holding the contact, they say it's gone posterior, but they're talking about the apex. See? So now they say the apex has gone anterior. This has gone posterior. See? So you get underneath here like this. And your contact is up into the sacrotuberous. I got some pictures I'm going to show you. Sacrotuberous and sacrospinalis ligaments. And you're getting under the sacrum with the idea of lifting it up. So your line of drive is up to the ceiling and up to the shoulder. And there's different concepts. You can start out with your thumb directed straight up the spine. But as you hold the contact, you slowly take your line of drive so it's up to the opposite shoulder. See? So it's called up, up, and out. Up to the ceiling, up to the shoulder, and out to the shoulder. Now, you hold a Logan Basic contact from 3 to 5 minutes. What you do. Now, at the same time, you use your other hand to hold pressures on the high transverse side. That's one adjustment that could be used on this patient. Another adjustment that could be used on this patient is you will always adjust the sacrum on the side of lumbar body rotation. So put an X right here. And then put an X right here. Now on your double PI, did I have you put X's on your pubic arches? Turn back one picture. I did? Yeah, sure. On the pubic arch, you should put on both of them.
The double PI?
Yeah, on a double PI, you put it on both. And this is a single PI. I mean, it's a double PI with a major and a minor, and they're so far different that when you adjust a major, if the leg, now see, this is where leg checks become very, very important to you. When you adjust this patient's going to have a short leg. Now, when you adjust them, if the leg's balanced, then your job's done. But as this person starts getting closer to health, now keep this in mind now, as this person starts getting closer to health, that lumbar body rotation is going to come out of there, and what you're basically going to do is take the patient back to a double PI, see? But, when it goes back to a double PI, this one will be smaller, and this one will be smaller. And you might eventually catch this one up to where it's equal to this. Now if you do that, you're back to a perfectly balanced pelvis now. So by x-ray, if you still have PI, you would adjust that again, and when you do, this leg might become short. Then you know you're just about back home, and you would adjust it. So leg check becomes very, very important when you're dealing with a double PI that has a major and a minor. As you get them closer and closer to normal, it'd be possible that when you adjust this one, this leg would become short, which would mean that you're catching your PIs up, and now you're going to have to correct this. But in many, many times, when you correct a major, the minor corrects, and you sit there and think, I didn't even touch that. How did it do it? That's what you call innate. I mean, sometimes all you have to do is break the dam. And then you just sit back and take all the credit for all the grass 50 miles away getting water. You didn't carry it down there by the bucket. But it wouldn't have got there if you hadn't broken the dam. So once you unlock the subluxation, and you go take a post x-ray, sometimes you just sit there and shake your head and look at your hands and wonder, how could they have done all that? Well, they did. Innate. So see, I know there's an innate, but I use it to the best advantage. And sometimes I just sit there and just marvel at what can be done. But how great it can be done when you do the simplest things right, and how innate won't work at all when you're just doing them wrong. See? Because now innate's fighting you. It's saying, look, I don't want no more of that crap. Okay? So those are the adjustments that you could use there.
Dr. Pierce,
Yes.
would you do the sacral adjustment first and then do Logan Basic on the same visit, or does it matter?
Now, if you're going to use Logan Basic, you don't have to use a sacral adjustment. I'll use the sacral adjustment over Logan Basic because it's faster, number one. But if a person's in a lot of pain, or if they're a kid, I'll go with Logan Basic because it's a lot better. Okay, what type of pelvis we have here, Ken?
Definitely a double AS.
Now this is a double AS. Do you want to tell us the points of a double AS?
Well, A would be an elongated pelvic ball.
And we call it an hourglass or a
Hourglass.
haystack effect paper ball because it comes in. Okay. What else?
And, the B.
B. C. What's C?
That's our narrow obturators.
The obturators are very small. Okay.
And,
How about
Cox.
C?
well, B.
B, I mean. What are those things that stick into the
Oh, PSS.
Ischial spine
Ischial
stick
spine,
into
yeah,
the pelvic
PSS.
opening. That's what makes it have the hourglass effect. And the
So our coccyx is, and the pubic symphysis is wide apart.
way up.
Way up,
Okay,
yeah, right high
contact
in the
point.
ball.
You can adjust the sacrum apex, put a great big X over here, which would be a palm contact. You just get on there and drop the table, adjust the sacrum apex. Then go down to the ischial tuberosity, put an X here and an X here. And that's your points. There are so few AAS's in the world, it's unbelievable. See, because AAS's would be the bottom compensation to a hyperlordotic neck. And there's no hyperlordotic necks. A hyperlordotic neck is a lower cervical curve that's normal and an upper cervical curve that's actually going kyphotic, see, or posterior. So there's very few AAS's in this world. Very, very few. And of course, when you have a AAS, you will have a hyperlordotic curve. It'll be less than 19. What do we have here? Good doctor, what type of pelvis we have here? What type of pelvis is that on the left? What's G? It don't tell you that. You're not going to find no help. What type of pelvis we have here?
It's like an INEX,
Which one's IN?
the left side.
Do you want to tell him the criteria of an IN? Bob, Rob, Chrisman?
Yeah, that IN, you're gonna have a wider halo.
And how about the alternative?
On an IN, you can see, it's gonna be narrower than,
It's going to be narrow side to side. So do we have an IN here? What we have here, good doctor? On the right, on the left side, what is that pelvis on the left side? Oh, what do you think? An EX on the left? Well, this is an EX. Yeah, this is an EX. What's this? What is it? It looks normal, by God. Guess what? It don't only look normal, it is normal. Now, the other one is EX. So, Brian, you think it's so funny. What is the criteria of an EX?
The ilium will be narrower, side to side, and the uptrader will be wider, look like a circle like that, I guess. And the, looks like the tailbone will, I thought tailbone would favor the IN side,
No, you're wrong.
but I was wrong.
You're
So
wrong.
Favor the EX side.
Yes. Whenever subluxation first occurs, the tailbone will always favor the side of subluxation.
I guess it's,
As the subluxation gets older and the sacrum base starts going inferior, then the tailbone will favor the opposite side. See, there's three different types of ways that the pelvis can get in trouble. One of the ways is the pelvis compensates to a cervical reverse curve. And it ends up going what, Laura? When it compensates to a reverse curve, what does the pelvis do? Goes PI. Then you get another accident. When you get in another accident, then the pelvis will go INEX. So now your pelvis will be PI, IN on one side, and PIEX on the other side. As this happens, the sacrum base will go inferior. Then you end up with a sacrum base inferior lumbar body rotation, a PIIN on one side, a PIEX on the other side, and the patient is gone as far down the road as he can go. And then the next step after that starts degeneration of the disc, spurring and so on down, ankylosis and so on down. But it all has a start. That's one way. The other way you can get it is you can have a fairly decent neck. And you don't have a loss of curves, but you go and pick up something real heavy. And when you pick it up this way, you know, like picking 2 cases of beer out of the back of your trunk, and you have one pair of clean pants on, and the car's dirty, and you stand back like this, that will give you a double PI. Then when you get the double PI from that, then it'll go in tie in the X. So you can get it from compensation, then having an accident. You can get it from heavy lifting. The other way you can get pelvic problems is this way. And this is from a fall. And this is when the sacrum gets involved first. So when the sacrum goes posterior, and this is why this will favor this side. Watch. It does this. Now I'm exaggerating. But this comes posterior. As that comes posterior, it slips the ilium off of the sacrum. And that makes this EX. Lumbars are still in good alignment. This is very easy to correct. This is where you would adjust the person right here. And you should be able to bring this patient back to normal with one adjustment. This is a fresh injury. This person can be carried into your office on a stretcher. You can make him walk out. This is where you look like a miracle. See, people, the more you can impress your patients, the more busy you get. If you get a patient in your office, you can make him walk out. Everybody hears that. And there's never been a person better than taking advantage of that than me. If I bring a patient in the office like that, and I know they've been injured, they've already been x-rayed in the hospital, and there's no fractures, I guarantee you that the ambulance can leave. Go ahead, take the ambulance back, go get somebody else in the waiting room. And take the patient in, adjust them, and walk them out. And there's nothing that impresses a waiting room full of people more than that, is there, Kate? This case here, you see that. There's certain things when you see them in your office, in the x-ray room. When I was first doing all this stuff, when I saw certain things, I'd almost jump out of the dark room. Couldn't wait to get my hands on it, because you know it's another winner. You know, it's like holding the lotto tickets in your hand, and you're the one that's going to pull the number. So you just put yours in. But when you see double PIs, when you see a sacrum like this, when you see a fifth cervical, those things are all bread and butter things. They're all things that happen really fast. The results are great right away, just like that. So when you see this, you're going to adjust the sacrum on the side of the X. And the rule goes like this. You will always adjust the sacrum on the side of EX as long as there's no lumbar body rotation. That's what controls your sacral adjustment. If there's no lumbar body rotation, you always adjust on the side of EX. Okay, we're going to adjust right here then. Put our X there. Geez, it's only 10 o'clock. It's almost quitting time. Okay, now we only have a couple more slides here, then I'm going to give you a break. Question? Question? Question?
Yeah, just regarding a time factor, would you hold a Logan Basic?
No reason to hold Logan Basic here. There's no Logan Basic needed here, Ursula. Mark that down. No Logan Basic here. This guy found the technique he likes, see. Now he wants to use it on everyone.
Get to grab those cheeks.
Now we're deteriorating again. Now we're starting to deteriorate. The normal side is now what, Ursula? That normal side, this used to be normal, is now what? It's now IN. Now first she said AS because she was strictly looking at what? Just the obturator. You never look just at obturators. And now AS has to have what with it? It has to have a what type of pelvic opening? A huge pelvic opening. This doesn't have it, does it? Does it have a high tailbone? It cannot be AS. So the only other thing that closes down the hole is an IN. But an IN also has to have a wide ilium. Do we have it? Yes. Okay. Do we have any lumbar body rotation? No. So how does the rule tell us to adjust? Where are we going to adjust, Mike Goad? We're going to adjust on the EX side. And the correction will be just as fast. You can correct these just as fast as you could the others. He's missing a page. You don't have a 24 either.
No one does.
No one has a 24. You have no one. Well, somebody goofed up again. One thing about my health, they're consistent. They are consistent.
Yeah, but trying hard counts though.
Oh, hey, they're consistently trying hard and getting better each time. I have good health. I mean, if they didn't make a mistake occasionally, I wouldn't have nothing to talk about. They do that just so I will be pissed off, see. You see, most of the people that are close to me, they think if I'm not yelling at them constantly, I don't love them no more. So they make these mistakes.
But we gotta change that rule.
No, that's a standard rule. That's a standard rule. You ought to have seen poor old Massa when I was teaching him the computer. I'm standing there adjusting, see, and he's moving the little hand around where I want it to go. And he'll get there. I did that, good doctor, but I've already got that adjustment done, see. I said, we're not going to live on our laurels. How about going to the next step? See? And I'll do that. And he'll be sitting there watching, because he's trying to learn. And I said, we're going to wait for the next step till tomorrow. And this poor kid is soaking wet by the time we go through 100 patients. I said, Massey, you're all sweaty. Look at me. I did the work and I'm not bothered at all. Oh, doctor, you make my head crazy. Hurry up, Massey. We want to get to the cabaret. So, no lumbar body rotation. The rule is the same, just on the side of the X. Now we're going to keep deteriorating. Now we have a sacral base inferiority. We have lumbar body rotation. We have a tailbone that's no longer in alignment. It's favoring the other side. It goes the other way. Then we have to change our rule. We no longer can adjust on the EX side. Because if we adjust on the EX side here, what would we be doing wrong there, Mr. Earring number 2? What would happen if I adjusted this sacrum here?
Make it more inferior.
Now, I'd make the rotation worse. See? So we change our rule and say when there's lumbar body rotation, you would adjust the sacrum on the side of lumbar body rotation, which would be right here. Okay, Jesse, you answered one question. Now let's see if you... What is another adjustment we could use here?
You do the PI or you could use the Logan on this one too.
What side?
Left.
You could use left Logan Basic. And as this patient keeps deteriorating, what will be the next step then, Lori? What will,
If the patient keeps deteriorating?
yeah, he will definitely keep deteriorating. So what's his next step? The pelvis is going to go what? It's I and EX now. Then what's it going to go?
Yeah.
It's going to go double PI. And then we're back where we started. We have sacral base import, lumbar. See, all three of the injuries ends up in the same place. But it's up to you to know where they came from. And you do that by looking at your x-rays and your case history. Now, let's see. Estes. What's your first name? Kevin. Just like Kelly, huh? Kelly and Kevin Estes. Okay. His brother was my very first intern the night we started tearing down the farmhouse. He'll never forget that as long as he lives. I had a real good question for you. Yeah, I forgot the damn question. But I'll remember it. And because it was a good question. Oh, I know what it is. How would you know by looking at an x-ray? What x-ray would you need to look at to tell us that you had a double injury, a cervical injury and a pelvic injury, and neither one of them came from the other? These are two primary adjustments needed here. How would you know? If you don't know, you're allowed to ask Kenny Guzik.
Help. I don't know.
Reason being, things that don't go together. Cervicals will be opposite to pelvis or vice versa.
Well, he's telling you, but he didn't explain it.
In other words, if you
What
have-
happened, you would have a reverse curve in the cervicals. You would have a double PI pelvis, but you would still have a good dorsal and lumbar curve. Then you'd know you had two separate and distinct accidents. Just like the arthritic rule. Anytime you have two separate and distinct accidents, there will be something in between that's good. Always remember this. You can't have anything that's moving up or down that's not getting progressively worse. So if you have a reverse cervical curve, a reverse dorsal curve, a reverse lumbar curve, and the pelvis is still good, then you know everything came from upstairs, but they're not to a point where the pelvis is turned yet. See, you get people in all stages of subluxation. So anytime that you have something bad here and something bad here, but something good in between, or like on the arthritic rule, something fairly good in between, then you know you have two separate and distinct accidents. And you must what? You must work on both of them because one subluxation does never correct another subluxation. One subluxation can only correct compensations. Okay? Now we're to the bottom of the list and we're as far down as we can go. Now this just shows you a total, everything's gone bad on these people. And that's all there is to line markings. And from the line markings, now you know how to adjust and do all those things. Now it's break time. Yeah.
This is the second time I just
Patient, like the pelvis, I mean, you always say that if they're superimposable, then they don't need to be adjusted. So in the case that you don't have any body rotation, lumbar body rotation.
Well, the next question would be, did this man do a heavy lifting? See, you can have a perfect compensated pelvis and still be primary subluxation. Like you could have a double AS if the guy was a football player because somebody hit him this way. Well, you'd go ahead and adjust that. Now, when I say that if you have a perfect compensated pelvis, normally they don't have pain. unless it's a fresh injury. Because when a person is perfectly balanced, even if their pelvis is wrong, if it's perfectly balanced, it's much better than a pelvis that doesn't look as bad that's unbalanced. See, unbalancing is the worst thing that can happen to a body. See, when it's unbalanced. So, if you have a double PI and you have a reverse curve and the tailbone's in good alignment, then that usually comes from up there. Unless there's been a history of an injury down here. See? So, if you have a patient that's in a lot of pain and is perfectly compensated, and you do your fifth cervical, and he's still in a lot of pain, you can get in no trouble by going after that double PI. So you would start out with perfectly balanced pelvis, you'd adjust the PI, the other leg would become short, and then you would go over and adjust it and rebalance them, see? But here you're using your dermathermographs, you're using what the patient tells you, and usually when a person has a lower back problem, if it's coming from the cervicals, as soon as you hit the occiput or fifth cervical, you know, it depends on what's needed, or sometimes both, you're going to get immediate relief. And the secret on anything is once you get immediate relief, is quit. Even if you had other things in mind that you wanted to do, always keep this in mind. There's always tomorrow. Don't do something and then turn around and undo it. And you know, all of these things were found accidentally. Whenever I found PIs, oh, I was so happy because I could change spines. Then when I found fifth cervicals, I was so happy. But I never quit doing the other things. See, when I kept adding things, that didn't mean I quit adjusting atlases and axes. But see, here was the thing. When I first found double PI pelvises, I would adjust double PI pelvises, take them right over to the side posture table and toggle their atlas. Until one day, I adjusted a guy's double PI pelvis, and he said, my headache's gone. I don't know, I'm going on a side posture table today then. See? Then I got a woman in from Florida that was beaten black and blue up her cervical. I mean, her neck could hardly move. And I've always been this way. If Laura adjusts an Atlas ASLP and you adjusted an Atlas ASLP, I'm not that much better of adjusting an Atlas ASLP. I mean, I've seen Dr. Steelwagon adjust something, I've seen Frank Wilhite adjust something, and the patient then comes to me. I don't adjust the same things they did because these guys are both great adjusters. I'm going to do the same thing. I'm going to fail like they did. And this is how I found a lot of these different things. So this woman came from Florida, and I thought, oh, her neck was so sore. You know, she said, I can't stand another adjustment here. I said, well, let's look at your pelvis. I looked at her pelvis. She had Logan Basic. She had double PIs. I did all that. In 3 days, her neck was better. You know, and then you start wondering. Well, then you start knowing that over-adjusting's bad. See? Now, we got an old man in, 78 years old, isn't he? How old is old Pete?
78.
This guy had a brain tumor before he come to us. He had a heart attack before he came to us. And he had headaches every day of his life. And he had a broken neck. And I'm up there tapping his neck with the instrument stuff. We're getting nowhere. And he said, see, he had a double PI that was in perfect compensation. But he had no pain down there. Well, when somebody's that old, you have to beware. You're going to wake up some sleeping dogs. You're going to add trouble. So I thought, I don't know if I want to do them double PIs. But he'd come in and say, you know, it's when I sit, that's when I get these bad headaches. When I'm walking or laying, it's not bad. But when I sit. So I said to Rob, I'm going after these double PIs. This stuff we're doing ain't working. Let's go after double PIs. Now, the double PIs, you ain't had a headache since. You know, when you do those things, sometimes you want to go over and knock your head on the wall. See, but that's why when you analyze somebody, you put down all of the possible adjustments they might need. You might put question marks by some. That means only if I get in trouble here. See? But you keep checking. So I was to a point when I found fifth cervical. I quit adjusting a lot of cervicals in. I cut them way back. When I started doing pelvic work, I found I could cut them way back on my cervical adjusting. I didn't know any why, but I knew I could cut it way back. Well, then when I did fifth cervical, I would do the fifth cervical first, and then I'd do the double PIs. And see, I'd work with different theories. Sometimes I would adjust the pelvis first, and then lock it in. That's what you think you're doing, by adjusting the cervicals. Then I got to a point where fifth cervical became the ranking number one adjustment. What I mean by ranking number one, I didn't mean I adjusted more numbers, but I was getting my greatest results by doing that. So it became number one on the hip parade. And that's what we used to have, the hip parade. So I adjusted fifth cervical. Then I'd do the double PIs. Well, we got this man drug in one day. And he's in the results book. He's one with all the medicine stuff. He has a picture of. And he was so bad that I didn't even interview him. A patient came in and said, Dr. Pierce, there's a person out there that's really in bad shape. Go give him my time. So I looked at this guy laying on the floor. I said, people, I'm going to do him next. You don't care. When I say that, nobody seems to care. Nobody's care. I say, well, I'm next. Well, you know what I'd say if they did, don't you? Not here, right? So I'd bring him up and, come on. I said, I have two diagnoses in my office. Sick and real sick. You're real sick, so I'm not even going to interview you. I'm just going to send you back to the x-ray room, get you x-ray, and then I'll fix you. So when he come in, I forgot that I didn't interview him. His x-rays are up, and as I'm walking across the room, I see that he's had a myelogram. I said, why didn't you tell me in an interview that you had a myelogram? He said, because you didn't ask me. I said, I always ask them questions in an interview. He said, Dr. Pierce, you didn't interview me. Oh, okay. I said, why do you have a myelogram? He said, don't worry about that. He said, that's not what I'm here for. He said, nobody can fix that. I said, well, what are you here for? He said, I'm here for my lower back. I didn't have the myelogram for that. I said, well, I can fix your lower back. No problem. But what I want to know is this thing that I can't fix. I want to know why you have set a standard on how good I am. Tell me what's wrong with you. He said, well, see my hair? He had a crew cut. I said, I like crew cuts. He said, I don't. I said, why the hell you got one? He said, because I can't comb my hair. I can't lift my arm. In fact, I can't turn my neck. In fact, I can't look up or down. And when I watch TV, they have to put the TV so high so that I can see it, and this is how I am. Oh. He had been to 72 doctors. I think the book says 60 because I cut it down. I didn't want to think I was lying, but it was actually 72. His wife was even sent to a psychiatrist because they thought she was driving him nuts. And he had been to 70 doctors and 3 psychiatrists, and she went to a psychiatrist. I said, well, the first thing we got to do is clear the innocent. How long have you been married to this guy? She said, 30 years. I said, how long have you been sick? She said, 3 years. You ate much of the world. You ate much of the world. It took you 27 years to drive him nuts. My wife did this to me in 27 days. You're off the hook, baby. Now it's between me and him. I said, Dad, she's off the hook. I said, you just met the man. The man who's going to get you well. And I have an intern stand there, you know. He told me, he said, I think you're nuts. I said, and he said, I'm an asset, Dr. Pierce, you know, the intern. He said, how can you stand there and say that? He said, you're either crazy or the greatest doctor in the world. I said, judge me later. So I laid this guy down on the table, and I adjusted his fifth cervical. And when I did, I wasn't that far out of my tolerance. And he said, my God, doctor, I'm well. I said, the hell do you say? Now, normally my procedure was bring up the table, turn him around and get them double PIs. And the intern saying, do you want, he's saying, do you want me to turn around? Hasn't your mother ever taught you when you're ahead, quit? So we got him up. I'm going to put him down for double PI. Just moved away. I said, bring him up. And he got up off the table. He said, Dr. Pierce, can I touch the floor? I said, how the hell do I know? I said, could you touch the floor before you got the cervical? Oh, yeah, I could touch that. I mean, let's touch the floor. He palmed the floor. Now, if you want me to palm the floor, bring it up to you. If you think I'm going to bend over that far to palm the floor, you're sick. But he palmed the floor. And I said, well, that takes care of the back. I said, lift the arms. Turn the head. I said, I'll be damned. How about that? So I said, go on home. I'll see you tomorrow at 8:30 or something like that. Never came. And see, whenever I have a patient that bad, if I have a real bad patient and they're supposed to be one of my first patients in the office, when I walk in, and I'll say to the secretary, how far down? See, and I don't go by appointment. I just go. Sometimes it'll be 25 patients in the morning when I get there. I'd say, where's Phil Rettenauer? You know. Then I go out in the waiting room if he's too far down the list because I'm too anxious to see how he feels if he was really bad. Hey, Phil, how you doing? One thing about me, I'm not afraid to ask the person in front of people because I know what I do works. How you doing? Oh, I'm great. But he wasn't it. But that's a different patient. One morning when I was a guy, couldn't move the night before. Hey, how you doing, George? Come on, Doc, let's do the twist, stuff like that. But this impresses patients. But Phil wasn't there, so I'm waiting, he don't show up till 1:30. I said, hey, you're supposed to come in early this morning. She said, Dr. Pierce, when he went home, I made fried chicken. He fell asleep with a chicken bone in his hand. I put him to bed. He slept from 8 o'clock till 8 o'clock this morning. I got him up to come to your office, and he was too tired. She said he went back to bed. He was taking 6 pills every 4 hours for pain. He never took another one. So that day we x-rayed his neck, and he went from either a 38 to a 50-something, but from a minus to a plus, and I can't remember what the numbers was, but it was a total reversal. But not from a 17 to a 17. It went like from a 54 minus to a plus 38, or reversed. I don't know what it was. But it was a big change. And I thought, I wonder what happened to them big holes. So I x-rayed his pelvis, and they were gone. The pelvis was correct. Now that really blew my mind because I love doing PIs because PIs for 20 years was my only adjustment that I could change spines. And it's a strange thing. Whenever you want certain type of cases, it seems like that's all you get. I mean, I got so many people that were PIs during those 20 years. When I think back today, I think, where's all my PI pelvises at? I don't have anywhere near as many as I used to. I'm as lucky if I get to adjust 3 or 4 pelvises a week anymore. And I used to adjust 100 a day. But anyhow, then I had to figure out, oh, geez, fifth cervical cures everything. Because what was the biggest amazement to me is when I started doing fifth cervical work, and I'd have inferior atlases that I had done this to. I had headpiece especially built to get that torque in there, and I never in 23 years took an atlas from there up to there, no matter how I torqued it or what I did with it, not one. And then all of a sudden, you're giving fifth cervical adjustments and you're taking atlases like that and setting them up like that. Then you start questioning, gee, many Christmas, I can fix an atlas without even touching it. See? But I really wasn't fixing it. All I was doing was structurally changing it. If it was locked, it was still locked in flexion or extension, but that was something I didn't know at the time. All I knew is I could take inferior atlases and make superior atlases out of them without touching them. That made me happy. Because for 23 years I had beat them black and blue and never moved one. And once I found a way to move something, and that's why I was so excited. I mean, when you fail for 23 years and all at once you become a miracle man, it's hard to keep to yourself. So I went right to Palmer College. I said, I got something that's fantastic. I can show you how to change spines. Oh, you'll have to go before evaluation committee. Go back and build up some records. I went back. This patient who I monkeyed around with for 15 years, I took pre and post x-rays, showed the pre and post before, nothing. Now changed, dermathermograph reading changed, documented letters telling people how great it was. I went back to Palmer College with a group of stuff like that, set before this scientific committee of 7 appointed idiots. 3 of them knew me, 4 of them didn't. The vote was 4-3. I lost. But you know what? I'm happy I lost. Because if I had given it to the school, I would have never taken it on. Then I would have just quit with it, you know. And they would have just threw it into the curriculum as another move, and it would have been lost. But luckily, they didn't. They turned me down. Now, of course, the day they turned me down, I was sick. But every time I'm turned down on anything, I usually come up with something better. Even like the property. You know, I looked in I looked in Arizona, I looked in St. Lucia, I looked in Florida. I wanted a place so bad where sick people could come. Mostly sick chiropractors need a place to go. And here, driving around one Sunday, I found a spot that if I had to sit down and describe what I wanted, this spot's better. Okay. And I can remember how broken, oh, you ought to have seen the movies I had made and everything when I was going to do some of these programs. I had one movie made for Arizona. It was backed up by Trenny Lopez singing Born Free. Then I went to St. Lucia, and I had a movie made backed up by Harry Belafonte singing This Is My Island in the Sun. Then I went to Florida, and I had a movie backed up with Somewhere in Time, because I had found a place that was built at the turn of the century. And this movie described how this place was built at the same time that D.D. Palmer discovered chiropractic. It had a fantastic movie, trying to get back, you know. And all these disappointments. And today, I came here, and of course, at 18 months I was here, I hated it. But it turned out to be one of the best moves in my life. And I think for some of you students, and that was the only thing that kept me going those 18 months, was the fact that I was changing a lot of your lives. And you would tell me how important I was to you, and that kept me going for them 18 months. But disappointment after disappointment after disappointment. But there's one thing about me, I never quit. I'm a bulldog. If I grab you by the ass, I'm going to eat it off before I let go. And, but all these things, they came from just things happening, like that one guy. Then I figured, now all we have to do is adjust 5 cervicals and we'll cure all double PIs. Well, the next 4 I failed. I did the 5 cervicals, didn't change the pelvis. Then the problem came, why would it change sometimes and not other times? And the tailbone was the answer. If it was in perfect alignment, I can change them. If it isn't, I can't. See? So that's how all these rules came about. It wasn't something that I set down with a goal in mind. See, when you invent or discover something, there's an old saying, necessity is the mother of invention. See? And when I first got the visualizer, I had no idea to what it would lead us to. And when we got the first adjusting instrument, gee, many Christmas, if you look at the first adjusting instrument I got in 1988 and look at the one we have today, it's unreal. But it took the first one to get me to the point where we are today. But we have a system that's beyond my wildest imagination. And the things that we're doing are just scratching the surface. That's why this research place is so important to me. So that I can get out there and just work on problem cases and figure out what's going on. Yeah, Ken? Nothing? Oh,
No, I was adjusting my thing.
Okay. But now we're going to go through some slides and we're going to get to test your ability on what I was talking about. Let's turn the lights off for this. Yeah. Yeah, turn the light on so I answer this question.
Sacral actual PI, ilium, something like that. A double PI, the other was one with like two no. What I want to know is why do you adjust the sacral base forward against
And when they both go, the whole thing goes. They all go. All three things go. When you have a single one, it's a pivot point back here, but the pivot point's still back there. And the PIs go worse than the sacrum. See, the sacrum base has to be posterior, and you have to have a poker spine before you do that. See, what you're trying to do is you're trying to throw one adjustment into everything. Number one, you have to remember that sometimes only one ilium goes. The sacrum's not even involved. The other ilium's still perfect. But eventually, the other one will go. Then the sacrum will go posterior. But a lot of times, the sacrum will go posterior first, whenever the spine reverses from up here. Then you go double PI. So it depends on what grade you get in. When you have a double PI is when I told you to adjust the sacrum straightforward. That was the only time. Every other time I told you this one side. See? So that's what happens. And you know, all these questions like he's asking are important because otherwise you'd walk away from here confused. Okay? And then make up an answer. And then it wouldn't work. In 1919, BJ was asked, what do you owe your success? Now listen to this wisdom. Results, he quickly replied. Results in getting sick people well put us where we are today. And we'll listen to the next statement. Not clever advertising, $200 free adjustments. Not smart business brains. Nothing but results. If you don't put results across, you eventually will sink. BJ, 1919. Now, I never read that book until after I named my book Results. See? And when I wrote the second books, I didn't know if I should say results too, or better results. Then we ended up just saying revised results. But, see, I was going to have like Buford Pusser, Walking Tall 1, Walking Tall 2, Walking Tall Final Chapter. I never want to write the final chapter. But results is what it's all about. You don't have to send birthday cards, you don't have to send Christmas cards, you don't have to advertise, you don't have to do nothing. My advertising is nil. I give out each patient a chiropractic and new beginning. That costs about 35 cents a piece. And I'll send a thank you card out for every patient who refers another patient. That's my advertising. And if you have a death in your family, then we always make sure you get a sympathy card just to let you know that we feel bad for you. Okay? That's all. That's all I do. Nothing else. And you see a person advertising a lot, you can bet he's not getting any results. He has to keep going back to the water fountain. Now you can only go to the water fountain so often, and then the water is dry. So eventually these people are burnt out and they disappear from the face of the earth. I've seen them come and go by the thousands of these people. High rollers. It never lasts. What lasts is a referral practice. That's what lasts. There's another normal picture. By damn, and I just copy them pictures out of books.
That's the one out of Gray's.
There's a spine on the left that will live forever. The one on the right is going to kill you. When you get reverse curves, you're dying. You're going to do something about it, you're going to die. And of course, this is Joe Felicia's degeneration chart. We have our own neurological deficit chart, which has about 100 and some pictures in it. Why don't I use things like motion palpation? Turn that light on. Because there is a fracture dislocation that is totally missed on a medical x-ray. Because it was in perfect placement whenever they cut the patient. The next day, whenever the spasm set in, it showed up. Now he walks into a chiropractor's office. I just been in the hospital last night, there said nothing wrong with me, all I have is a stiff neck. Because that's all he had. He had no pain, nothing, just had a little stiff neck. Now if you motion palpate this person, would you find taut and tender fibers? A few. Would you find fixations? A few. And if you went ahead and manipulated him, you know what you'd have done? You'd have killed him. So don't you ever take anybody else's word. You make sure you look at x-rays. Okay, now here's a person that had some spinal surgery. That, my friends, is a flat lateral picture. Okay, now we're going to start with some questions. Where to get you? What type of atlas does this man have? Plus, absolutely. That's a 62 degree. Okay, now he had surgery between third and fourth. Okay, you. How old is this sixth cervical subluxation? Approximately. Well, there's 3 vertebrae with arthritis on it. Well, let's count. It started at 6. Then it moved here. Then it moved here. It's already starting here, so it has to be here. So we have 5. So you have to assume sometimes. 25 to 30 years. Okay? Now, if we have a 6th cervical subluxation here, then what other vertebra do you think was possibly subluxated that we can't pick up on here? Huh? I'm saying 6 is subluxated because of the arthritis. Hey, it's not your turn. Huh? No. Third's made is 4th. So it will be affected, but we don't know if it's subluxated. Which one, since 6 is subluxated, we know there had to be another subluxation before that. He gave you the answer. If we have a C3 subluxation when the neck is whipped, it'll never whip at 5, it'll whip at 6. And where did they do the surgery? They did the surgery between 3 and 4, so there probably was a slip disc there. Does that mean that that slip disc was the cause of our problem? No. Here's a rule. You can adjust a vertebra with a slip disc as long as that vertebra is subluxated. If you adjust that same vertebra when it's not subluxated, you will break the disc. And I've seen chiropractors do that over and over and over again. They did it on one fellow chiropractor in Ohio. This guy had a reverse curve. He came to me, I straightened him out. He was on an airplane accident and an airplane, and he went to sleep and jerked his neck forward. He lived 110 miles from me, and in his own words, I don't think you're the only one who can adjust. Right? That's true. I'm only one of the few that know when to adjust. So, he went to another chiropractor. The chiropractor gave him a Gonstead move in the chair, and he felt better immediately. So the chiropractor gave him a what? A good adjustment, didn't he? A week later, he went back. Most chiropractors think this way. If one's good, what's 2?
Better.
He adjusted him again, and within hours, his arm was atrophying. What did he do this time? He ruptured a disc with the exactly same adjustment that made the guy feel good. He came back to me, he's in horrible shape. I couldn't stop the pain. He went and got surgery. They fused him in a reverse cervical curve. they signed his death warrant. Still didn't help him. He came back to me by adjusting his atlas and rotating his dorsals. I got him feeling good, got him back to work. I didn't see him for a year and 3 months. A year and 4 or 5, 6 months. And Oz went up to Pennsylvania just in October. He said, I want you to come up. When you come up, I want you to adjust me. I said, well, I usually adjust most everybody at seminars. Oh, I want you to do me in private because I'm so bad again. When I got there and visualized,